5 psychiatric drugs associated with the most sedation. Hi, I'm Professor Ahmed Hankir. I'm a consultant psychiatrist, and my job is to diagnose and treat mental health conditions. I'm also a person living with a mental health condition who has previously taken psychiatric medications. Drug 1, olanzapine. Olanzapine is what we call a second generation antipsychotic. It's a newer antipsychotic, whereas first generation antipsychotics are older ones. Olanzapine can be highly effective in the treatment of psychotic illnesses and mood disorders such as bipolar disorder. However, the sedation associated with olanzapine can be substantial, and for this reason, it is usually prescribed at night. This can be helpful for persons with mental health conditions who have difficulty falling asleep, which unfortunately is not uncommon. Drug 2, quetiapine. Quetiapine is another second-generation antipsychotic. Similar to olanzapine, quetiapine can also be highly effective in the treatment of psychotic illnesses and mood disorders. Similar to olanzapine, the sedation associated with quetiapine can also be substantial, and this is a common reason why persons stop taking this medication. I did create a video about quetiapine and my personal experiences taking this medication, and the reason why I stopped taking quetiapine and why I've included it in this list is because it knocked me out. I simply wasn't able to stay awake whilst taking quetiapine, and at the time I was a medical student attending clinical placements, and I was literally falling asleep during classes. Drug 3, mirtazapine. Mirtazapine is an atypical antidepressant that is primarily used in the treatment of major depressive disorder. However, it can also be used in the treatment of anxiety disorders, such as generalized anxiety disorder. Patients report that mirtazapine can be sedating, certainly in the lower dosages. However, we can use that to their advantage because we can prescribe mirtazapine at night to treat the sleeping difficulties and insomnia that persons with major depressive disorder unfortunately commonly experience. Drug 4, lorazepam. Lorazepam is a benzodiazepine that is commonly prescribed in the treatment of panic attacks. Because of its sedative effects, it is also commonly prescribed in persons with mental health conditions who have sleeping difficulties such as insomnia. Like other benzos, lorazepam can be addictive, and so this drug must be prescribed carefully and with caution. And drug 5, promethazine. Promethazine is an antihistamine that is primarily used in the treatment of allergy disorders such as hay fever. However, because of its sedative effects, it is also used in the treatment of sleeping difficulties in persons with mental health conditions. You must consult your GP and/or your psychiatrist before making any decisions about your mental health medications. When we prescribe psychiatric drugs, we take into consideration the effectiveness of the medication and the acceptability of the side effects. It's often a trade-off between the side effects of the medications and the symptoms of the condition. I hope that helps, and as always, protect your minds and protect your hearts, and bye for now.